Hi Olivia, my name is Crystal and I'll be your student nurse for the day. Can you tell me what brings you into the office today?
Well, I busted up my left wrist and jaw 2 weeks ago. I had a pretty bad car accident. I went to the ER and I'm here for my checkup so I can start working again. I just want things to go back to normal and forget about the whole thing.
Okay. Well, can you tell me how you're feeling today? Are you experiencing any pain? Like on a scale from 0 to 10, what would you say it is?
Yeah, I do have pain. It's 4 out of 10.
Are you taking anything for the pain?
No, I'm not currently taking anything for the pain.
Okay. Well, your vitals were elevated and your blood pressure was 168 over 98 and your pulse was 130. Do you have any medical history and or family history? Any past medical history of hypertension? Because when someone has high blood pressure or high heart rate, we like to assess them for some causes.
No, I don't have any history.
Okay, do you mind if we took a couple minutes to talk about how you're feeling right now?
Sure, I feel anxious and I feel like my life is not going right. I'm hurt because my drinking has affected my job and my relationship with my spouse, and I want to change.
Okay, so before we start, would you mind taking a few minutes to talk to me about your use of alcohol?
No.
So do you sometimes drink beer, wine, or other alcoholic beverages?
Yes.
How many times in the past year have you had 4 drinks or more in a day?
Whenever it's needed.
Okay. Well, thank you for taking the time to fill out the audit before our interview. It looks like you scored a 9.
No problem.
Okay, so now I'm going to ask you a couple questions in regards to your use of alcoholic beverages during the past year. Would that be okay with you?
Yeah, that would be okay.
Okay. First, could you tell me some positive things about drinking alcohol?
The positive thing about drinking alcohol is that it helps me reduce my stress. It helps me get away and deal with the stress, and it is my coping mechanism.
Okay. So can you tell me some negative things about alcohol?
Drinking has affected my relationship with my husband and my job. My spouse and I have not been getting along well lately.
Okay. How about other relationships, and has it affected with your work at all?
The drinking, it has affected my relationship with my husband and with work.
And what are your thoughts on that?
I do not like it, and I really want to change.
Okay, so how about, let me summarize what we just discussed. So far, you have stated that drinking has affected your relationship with your spouse, which you are not satisfied about. And also, it has changed your career as well. These things are bothering you, and you're looking for a change. How does that sound? Are you okay with that?
Yes.
Do you have any history in your family for alcohol abuse?
I got drunk the first time at age 17, but over the past 18 months, I started drinking secretly 6 to 7 shots of gin a day, and no one seems to notice.
Okay, so you were exposed to alcohol at a very young age and gradually increased. Is that correct?
Yes.
Okay, I see that your BMI is 17.5, which decreased from 19. This is slightly concerning because you are below the recommended weight. We would like to keep assessing and monitoring this factor. How's your appetite lately?
It's not good.
Okay, so I do have some information about the guidelines for low-risk drinking. Would you mind if I share the information with you?
Sure.
Okay. So we know that for females, drinking more than 7 drinks per week puts them at a risk for illness or injury. It can also cause health problems like damaging the liver, stomach, pancreatitis, can cause cancer, malnourishment, and heart problems. Also, alcohol withdrawal can occur that can cause agitation and irritability.
Oh wow, I did not know that.
So what meal would you say you skip most often?
I would say lunch. I work 9 to 5, and during lunchtime, I sneak into a closet and drink my alcohol that I have stashed in my work locker.
Okay, well, alcohol can heavily affect your stomach due to the increased acidity level and can turn into gastritis. Do you know what gastritis is?
No, I don't.
Okay, so gastritis means an inflammation in your stomach lining. So because due to inflammation, this may cause you to have a decrease in appetite and have an upset stomach. So I would suggest reducing drinking before meals to help you eat better.
Oh, okay.
So what are your thoughts about that?
That does sound unhealthy. I guess I should start taking care of my health.
Okay, so let me summarize everything that we discussed about. At any moment, if I'm incorrect, can you stop me? How does that sound?
Sounds good.
So at age 17, you started drinking, which gradually increased to 6 to 7 shots of gin a day. You also stated that you skipped lunch to drink alcohol during your lunch break, which I gave you information of the negative effects that alcohol has on your nutrition. After going over the information, you acknowledged that you wanted to change your habits. Am I correct?
Yes, that's correct.
Okay, after all the information that you have given me, on a scale from 0 to 10, how ready are you to make a change in your life? 0 meaning you're not ready at all, and 10 meaning completely ready.
I would say on a scale of 0 to 10, I would say a 7.
A 7 is a great score. That means you're 70% ready to make a change. How does that sound?
I think that sounds doable. It sounds good to me.
I think so too. So, what are some options and steps that you can take that will work well for you?
I could start attending AA meetings again and reach out to my friends for support. I'll also start eating lunch again and getting some exercise.
Sounds like the resources that you currently have are helpful. Can you tell me a time where you were able to overcome your challenges in the past?
I sought help 2 years ago and attended AA meetings regularly. After the accident, I felt useless and resorted to drinking again. However, I'm willing to try again.
Mm-hmm. You handled yourself really well in that situation. You're definitely capable of making this change. I can tell you are motivated. Now that we're coming to an end, will you be able to summarize the steps you will take to overcome alcohol use?
Yes, I will quit drinking by throwing out my liquor in my work locker and garage. I will then attend AA meetings regularly, work on my relationship with my spouse and my friends, and lastly, I will try to eat healthy and pick a new hobby.
Great, that sounds like achievable goals. I have some instructions for you to keep as a reminder. The doctor has suggested a couple referrals for you. I also have attached another sheet giving you other resources you can utilize to help achieve your goals. Thank you for sharing with me. At our next visit, we can discuss alternative strategies for dealing with stress. How does that sound?
This sounds good.
Thank you for coming in today.
You're welcome.